This is 3Q's interviews. We're here with Dr. Triffon. Dr. Triffon is the father of one of my longtime friends. Dr. Triffon, you'd like to introduce yourself?
I'm Mark Triffon. I'm an orthopedic surgeon here in Columbus, Ohio, and Spencer and my daughter Melina went to school together and grew up together.
Fantastic. How'd you get into orthopedics?
Well, I've taken a longer course than most people. When I was in med school, I had some health issues and some other things, so I took a longer path. I ended up doing a full pediatrics residency, and then another internship, and then a full orthopedics residency. So I'm a pediatrician and an orthopedic surgeon.
Wow.
And I take care of a lot of kids in my practice as well as an adult. So I did 3 internships, 2 residencies, and a fellowship.
Wow.
Which is long.
Yeah, I actually didn't realize
Which is long, yeah.
So
that's not the usual course.
So what would a usual course look like?
Med school for 4 years, and then your residency 3 to 5 years, depending on surgical versus non-surgical specialty, and then a fellowship after that. So 4 years plus 3 to 5 plus a year fellowship, give or take.
Okay. What do you like about orthopedics? What made you choose orthopedics as opposed to how'd you get into it?
When I was in my peds residency, I was always affiliated with, always grew up playing sports and stuff like that, and I missed doing that. I missed being in the operating room, and I was counseled by my professors that if I felt that my calling was to go into orthopedics, to reapply, and I did, and thankfully I got accepted, and I moved on from there. But doing the pediatrics part made me a much better physician.
That's awesome.
Yeah.
So in your practice here, you also take care of some sports teams, and could you talk about how that impacts your practice?
I take care of the Columbus Blue Jackets NHL team, and the help with the Columbus Crew soccer team, and also Rahal, Letterman, Lanigan IndyCar racing are the teams that I work with. It's good. It gives you something to do outside the office. It's fun to be around the guys, and for a sports medicine and trauma guy like me, it's good exposure and good PR.
That's fantastic. So what kind of does that look like for a typical week for you? How often are you seeing patients in the clinic like this, and how often are you?
I'm in clinic a little more than some guys. I'm in clinic 4 days a week. But then if a player is hurt and we did not, and they needed to be seen outside of the locker room during or after a game, then they'll come to the office here to get further evaluation and stuff like that. So probably in the office setting, we don't see more than 2 or 3 of the athletes a week, because we're primarily seeing them during practice or during the game or after the game kind of thing and all that. So a lot of the teamwork is actually done at the arena at night, not as much in the office.
Oh, that's interesting. Do you have to travel with the team, or how does that impact your family life?
Each professional team and every professional sport does it a little bit differently. In the NFL, every doc travels because it's only on the weekends, kinda, you can say, and it's 1 game a week and all that. Some of the Midwest teams, their docs will fly in the local Midwest for away games, and our team, we travel with the team on special trips, and obviously for the playoffs. So anytime we're in the playoffs, we travel for every game for that.
Excellent. If there's a medical student that's interested in orthopedics, do you have any advice or something they should do to figure out if they like it or not?
In the old days, when you wanted to go into ortho, you had to have all the right courses, and even to get into medical school. Now, from what I understand, it's a far more well-rounded thing. You can be a music major as long as you do well in your science courses, and that's what everybody's looking for. Orthopedics is a great job. Medicine is a hard profession and all that, but the benefit of orthopedics and orthopedic surgery is people are injured. No matter what age they are, anybody wants to get back to being more active. Even 90-year-old patients want to be more active. And that's the benefit. You can see the results of your work, and it's rewarding because, like I said, not everybody will take care of themselves for their medical ailments. Most people will take care of themselves because they want to get back to doing the things that they want to do.
Right on.
Yeah.
Okay, so we'll do our 3Q's, part of the 3Q's interviews.
Yeah.
First question, what's a common myth or misconception you get from your patients you want to dispel?
A lot of people don't think that physical therapy, whether it's formal or informal, is necessary, and I believe that flexibility is the key at any age to limiting injury and recovering from injury. So a lot of people say, why do I need to go to therapy? I'm a true believer in it. I'm a true believer in massage and massage therapy and the skills that a massage therapist has too. So not every injury needs an operation, and not every injury needs therapy, but the more flexible you are, the better shape you're going to be in, and the more injury prevention you'll have from that, and then certainly the rehab afterwards it helps you get better faster.
That's awesome. Question number 2, what is your favorite exercise at the gym?
Well, that would be before I started falling apart as I got older. I love to play basketball for 3 or 4 hours, and that's what I miss doing the most at my age. But doing biceps curls and bench presses were my 2 things that I used to do.
There we go. And what's your favorite thing about being a team doctor?
I think it's just the camaraderie of being back in the locker room.
Yeah.
And even though you're not part of the team and you don't live through the team's thing, it's still fun to be in the locker room and joke around with everybody like you do, being part of any team. And then obviously the camaraderie of when you have a good season is fun for everybody. And if you can help someone do better at their career, whether it's professional sports or anything else, that's the gratifying thing about being an orthopedic surgeon.
Dr. Triffon, this was great. Thank you.
You're welcome, buddy. Good luck to you.